So we're going to apply Shockwave for biceps tendinopathy. There's no consensus in the research about which settings that we can use. I'm going to start the bar pressure quite low because there's not much padding around the front of the shoulder there. I'm going to use 2000 shocks and I'm going to use 12 hertz to start off with. So here we're just working the shoulder into internal and external rotation just to locate the biceps tendon and the bicipital groove. We're going to apply some gel and then we're going to commence treatment. As you can see with our model here, it can be quite a shock when we start up a Shockwave machine, so it's always really useful to warn your patient how the machine is going to sound, and you can even start it and apply it on yourself briefly just to get them used to it. With biceps tendinopathy, I always like to confirm my diagnosis with ultrasound, as often it's mimicked by cuff tears. Surgeons that I work with often find that when they are repairing cuff tears, biceps tendon is often frayed when they carry out a tenodesis or a tenotomy.